there are a lot of available therapies for myeloma, and I'm wondering what factors might impact treatment decisions. You did mention comorbidities, but what other factors are there?
Sure. And I think in part it depends on if we're talking about induction therapy or in the relapse refractory setting. Let's focus on induction therapy, right? There are some drugs that we're typically going to employ pretty much universally. For those who are inclined to use that CD38 monoclonal antibody that I mentioned, it pretty much plays well with patients of all walks of life. So that's one where I feel really comfortable regardless. Lenalidomide is a drug that, we don't necessarily know from the get-go if there's going to be a patient that's not going to tolerate it well. We might reduce doses up front, but for the most part, that's another drug that we're typically going to use. I would say the one exception is for patients who have a simultaneous diagnosis of amyloidosis. And we know that in amyloidosis, lenalidomide may not be as well tolerated. But actually, one of the key decisions that I'm often making in clinic myself is around that drug class that I mentioned earlier called proteasome inhibitors. And I mentioned two different drugs. There's bortezomib and carfilzomib. And they actually come with very different side effects that I think are important to mention. Bortezomib is one that is typically associated with a high rate of numbness and tingling, what we call neuropathy in the fingers and toes. And, about 75% of patients have been reported in the trials to get this. And most of it is what we call lower grade. But, I'm not in the patient's body, and I don't know what even a grade 1, which would be the lowest grade, really feels like. And if I have a mechanic, somebody who types for a living, a surgeon, somebody who uses their hands or rely on their feet, for their day-to-day, that's a scary prospect, right? The flip side is this drug, carfilzomib, is one that, does not really cause nearly as much neuropathy, but has been associated with cardiac effects, heart issues. And so that can scare people, right? Heart's important, I hear. So, we have to be really, careful in how we pick these therapies and talk about it with patients.